I told my dad the next morning, I said, hey, I got a job. Yeah. I said, it's for a medical marijuana dispensary group in Pittsburgh. He didn't look at me. He said, well, is it legal? I said, yes, Dad, it's legal.
Welcome to Healing Hearts, a podcast created by the Healing Center, voted Pittsburgh's best dispensary.
The Healing Hearts podcast coming from the Center for Media Innovation at Point Park University. My name's Mike Flick, and one of our pharmacy managers at the Healing Center is joining us today for the podcast, Jill Zimbicki. It took me so long to learn how to say your last name the right way. It really did. But
hi, Mike. Thanks
hi,
for
Jill.
having me here.
Well, let's talk about why you're here and why you made it to the Healing Center. What's your background? Where did you start before you were a dispensary manager at our Washington location?
Well, for the past 10 years, I've worked in managed care for an insurance company.
Okay.
Reviewing cases for drug interactions, opioid abuse, things like that. What got me to the Healing Center, I've always had an interest in more of the traditional holistic side of medicine.
You were telling me before last night your brother's, he's really into holistic medicine?
He's a nutritionist. So, I've seen a lot of his patients benefit from that side of medicine, so that really interested me in that. So when I heard that the Healing Center, was hiring pharmacists, that really inspired me to pursue a career in it.
What's the biggest difference between what you were doing before as a pharmacy? What were you doing before in that position exactly?
Well, I didn't have any patient interaction at that position. It was more contacting doctors about patients' therapy. And I really missed that one-on-one interaction with the patients. So
it's almost like you were consulting with the doctors more than anybody?
Right.
Okay.
Exactly.
What's the difference, the biggest difference, going from that to what you do now? I mean, you do about 1,000 things every single day. You're the dispensary manager. I mean, you're running the store. Right. You're making sure the place doesn't burn down on a moment-to-moment basis. and even deeper than that, you're consulting patients, It's a far leap for you. What's in that leap?
Just the difference is just, I feel like I'm really making a difference in patients' lives, helping them, guide them to using a more natural, safer medication, to help them with, a healthier alternative that hasn't been available to them for so many years. And I really see it benefiting patients. And that's really, rewarding to me, because I found that, in this job, like I make a difference in their lives.
You do. You actually get to help people. I mean, we see it every day in that dispensary. It's something incredible to see when somebody comes in, at least for me, the first time, and they've got that rough look on their face. They've had pain, especially, around our area. We've got a lot of those blue collar workers. They worked in the factories. They drove truck for 25 years, rough jobs that a lot of people did, worked really hard at for a number of years. And they come in and you give them an indica or, something that's going to help them get a good night's sleep. And seeing them come in the next week with color in their face, it's really changing, isn't it?
It is. It's like I said, it's very rewarding, and just not only helping with sleep, but with their pain too. Some people, like especially elderly people, are there, because of their pain and not being able to walk, and they'll come back weeks later and they'll be walking without their walkers or canes, and it's just amazing to me.
It sounds crazy when you say that, you know what I mean?
It really is, yeah. It really is, and just knowing that I'm helping them, really is so rewarding. Kind
of being able to usher them to that
right,
point.
Just guide them to, to find what works best for them and to help them, guide them through their journey of what, the relief that they're searching for.
Journey is the key word there too for everybody, because I feel like when people come into the Healing Center, it's certainly not a one size fits all answer. At least from what I've seen,
Right. Yeah. And everyone is different. So it's very individualized, and the lack of research, there's no textbook guidelines to say what dose you take with what medication, just like, in normal traditional pharmacy. So that can be challenging too, trying to find the right product for each patient, trying to, make them understand that they have to have patience. It's not going to be like, oh, this is the first time you come in and, this is going to work for you. So it is a lot of trial and error.
Absolutely. And it's a journey, but we had to get there for patients, but we certainly went on a journey of our own. Let's go back to kind of day one, because you were the first. You were the first manager for the Healing Center. I mean, there's not a lot of people in the state who can say that they were the first dispensary manager for a company selling medical cannabis, and it's I mean, you're kind of a big deal. Going into that, what was your expectation, and how? Because it's just mind blowing.
Yeah,
then how different was it once we all got in there and the doors opened on day one in that Washington location?
I mean, I didn't really know what to expect. I tried to prepare myself as much as possible. I studied what I could. We didn't learn about medical marijuana in pharmacy school. They didn't teach us that. So
that's so weird.
Yeah, it was up to me to kind of, research that and find what I could. And so that was just, just very challenging. I kind of had to wing it, going in to start those consultations with patients, and, go by their conditions. And it was difficult at first.
It's kind of it sounds like it's kind of an accumulative education.
It is. It's very ongoing. And I actually learned a lot from the patients, when they would come back and tell me what they took and what worked for them. So I used that to help, with my new patients, and use that knowledge to guide them too.
Yeah, and you were talking about how it's not taught in pharmacy school. I always think about when we were first meeting. We call it the bunker. It was this place where the original crew of the Healing Center, we got together. We started learning about as much as we could. And I remember Mr. Butler, our general manager, who's going to be on with us in a little bit here, him talking about how there's the endocannabinoid system that goes over everything, and they don't cover it. And that's nothing that's talked about in pharmacy school, and it's something you guys have to learn, and it's something that's very under researched, and there's just not a lot out there about it. And it's a crazy thing to me. It really is.
And it's really amazing that it's really helping so many people. And it's so safe and it's natural, and people have been using it for thousands of years. And so that's what's so amazing about it, is that now people are using it on a day-to-day basis, and it's helping them.
And with the products we have, as opposed to, products that people may have tried in the past, these things, all these products that come into our places have labels on there. They're safe. They're clean. There's no pesticides. The state of PA did a phenomenal job on. I don't know if everybody knows that, but they did an amazing job at setting the restrictions on pesticides really hard, really strict for the grower processors, which just to what you're saying makes a clean and healthy product for those patients that we have coming in.
Right. So I can feel confident in making recommendations, knowing that they're not going to have, harmful effects with that.
I feel like what you're saying right now is part of the next thing I want to ask you, but there's definitely a bigger answer there. Why do you do this?
Well, like I said before, I feel like I'm making a difference in people's lives. Like, I wanted to guide patients to find a healthier alternative, a more natural alternative. I saw a lot of patients taking so many different prescription medications. They come into the dispensary and none of them really work for them anymore. So, and this is the one thing that's actually working for them. Yeah. So that's why I do it, because, I like to help them find their success in their treatment and give them the relief that they're really looking for.
That's awesome. And that's why we love you, Jill.
Thanks.
You get a lot of first-time consults. So when you come into any Healing Center location, the first time it's required that you have a consultation with one of our pharmacists to help determine the trajectory of your medical therapy. That's the first thing they do, is they meet you most days when they come to the Washington store. If somebody listening to this right now, they're thinking about coming out to us for the first time, maybe they're a little apprehensive. There's been a lot of negative stories in the past about the product that we now use for therapeutic reasons. They've got a lot of questions. What's the best piece of advice that you would give to somebody before the first time they come into one of our locations and have that consultation with you?
Just don't be scared. Don't be scared to try this. We are here. I am here to help guide them through this. And so are the other, patient care reps that work there too. We're very friendly and welcoming, and we're going to try our best to educate those patients through this journey, and just keep an open mind. Don't set expectations for yourself. This may not work the first time. It may take some patience and trial and error to find out what works best for them. But just, my advice is don't give up. Don't be afraid and don't give up on it.
That's awesome. Thank you, Jill. And this is a great time to bring our GM, Mike Butler, into the conversation. Let's take a break and we'll do that right when we come back.
Hi, this is Chris Cohan.
This is Jay Richards.
Hi, this is Mike Flick.
And we'd like to take this time to thank you.
Thank you so much.
Thank you for listening to the Healing Hearts podcast.
And we're back with our general manager, Mike Butler. What brought you into this industry? What really changed everything? It seemed like from what you told me before that you had a pretty natural inclination in college towards pharmacists, because you're a pharmacist as well.
Yeah. I mean, I'm a chemistry-minded kind of guy. I remember molecules. I remember numbers. I forget names and faces. That's just kind of the way my brain works. I'm one of those black and white kind of people. A little nerdy.
That's it. Nerds make the world go round, man. Elon Musk, I think he would take the word nerd as a compliment. So you're a good company there. Absolutely. So you were working, after you go through college, you kind of had a natural attraction into pharmacy. Next was the retail world. What was that? You were there for quite a few years.
Yeah, I was pharmacy manager for Rite Aid in Clarksburg, West Virginia for a number of years. We were right across the parking lot from the biggest opiate addiction treatment center in Clarksburg.
Wow.
So I was right on the front lines of the opiate crisis.
Literally.
In central West Virginia. Yes, sir.
You shared a parking lot with it. Wow.
It can be discouraging over time. There's a lot of people, there are, thousands of people that are really genuinely seeking help with opiate addiction. And the traditional medical solution generally is simply replacement. And there is a place for that. Replacement with methadone, replacement with the new drug Suboxone, which is buprenorphine.
This is kind of substituting one after the other for the other.
Exactly. And the idea that you want to get over something that you're addicted to is the freedom of not having to be tied to that thing.
Right.
So substituting something else that you are still tied to, yes, maybe perhaps you're no longer taking heroin, or maybe you're no longer taking the opiate pills, but you still have yourself, you are dependent and you are tied to something that restricts your freedom in a very real way.
Right.
So
you're still tied to something.
That's only part of it.
Yeah.
Right.
So seeing that happen literally across the parking lot from you, how did that, was that part of your leap from the pharmacy retail world into where we are now?
Well, I was pretty discouraged over time because I genuinely did not feel like I was part of the solution to the problem in West Virginia, which was, of course, my goal. Every medical professional, we all want to make things better for our patients. We want to make a better environment in general.
That's why you get into these things,
exactly.
Right?
But I really felt like I was becoming part of the problem as opposed to part of the solution.
By filling these big prescriptions of all these pain meds that we're getting, I mean, in my opinion, in some people's opinion, overprescribed,
Yes. Coming from the place where I am, I can certainly say that I feel there's a lot of overprescribing in standardized medicine. So yeah, I was the biggest supplier of opiates and benzodiazepines to that area. The guys from Detroit and Pittsburgh had nothing on me. Milligram per milligram, I put more of it out there, and it really weighed extremely heavily on.
And that's all legal. Those are all drugs that people think they should be taking because their doctor tells them to take them. This is 100% everyday life, right?
Yes.
It scares me. It really does. And the upside is nowadays we see some of those folks come in our facility and they're able to find an alternative. You kind of see that bridge there.
We do. Yeah, we see that a lot. And I think the problem is in standardized medicine, although perhaps if someone has 15 different medications they have to take in a day, we can analyze each one of those molecules and give the reason why that's part of their medical therapy. But that doesn't change the fact that when you step back and you look at the whole forest, that as that medication burden increases, quality of life decreases.
Right.
So those
right.
quality of life measures continue to go down.
Because those drugs take a toll on your body.
They do. And over time, you see more and more. And the problem is, even if you have a patient that wants to decrease their overall medication burden, so they go to the doctor and they say, I got all these meds, I want to take less. So where is the doctor that's going to take a look at that and say, okay, of all of those, I'm going to take you off of this one. Now, the second the doctor does that, they are exposed to such a huge potential liability, because if a month later or 2 months later something happens in that person's life,
sure.
Well, hey, who do we blame? Well, you told them to quit taking this medicine.
They listen to their doctor. Yeah.
So it's really, we don't have a pathway in standard medicine to provide a decrease of medication burden.
That's an incredible way to think about it. I mean, it's again, a little bit terrifying. But wow, that's kind of jarring. I'm not gonna lie. But a lot of things are crazy, including you. And I mean that totally in a positive way. You accepted a job as the general manager for a medical marijuana dispensary. How insane did you feel after you made that decision when you made that leap? I mean, there's no way you could have known what you were up against going in.
No, we had no idea. I mean, I certainly had no idea what all it was going to entail. But I did see medical marijuana coming in PA. It was something that I followed, and I was actually watching the news one night, and I saw that this place called the Healing Center was having a job fair down on the south side. It was late October, so I put my best three-piece suit on. Ended up being 95 degrees that day. But I met Jay and Chris, Jay Richards and Chris Cohan, our owners. And fortunately, a few months later, I convinced them that I was the guy they wanted to go with to help build the company. And all I really knew, Mike, going in is that regardless of what I faced, I would rise to it. And that's something that every single person has the ability to do, whether we believe in our minds or not.
Absolutely. You're getting me a little misty over here, man. That was good. Why you do it now, though? I mean, everything's changed. I'm sure your perspectives on cannabis and its medical therapy have evolved over the past 2 years as you've been in this. I'm sure it would have been a different answer back then. Why do you do it now?
Saying that my views and opinions of marijuana have evolved over the last 2 years is a vast understatement.
Really?
Vast understatement. This is absolute true medication. I have seen patient after patient whose lives have been completely transformed. I can't count on my fingers and toes how many over 65-year-old wives and husbands have come back and said, you changed my life. You changed my spouse's life. My husband's taken me on vacation for the first time in 10 years. My autistic child spoke and has been nonverbal for 7 years. It's unbelievable. People that were taking had huge medication loads. One that I know on at least four different blood pressure meds, literally stopped taking them. She went to the doctor a couple of months after she started medical marijuana, and they said, wow, those meds are working pretty good. Your blood pressure is perfect. They were blown away when she told them. Now, this is not everybody.
Right.
I would not suggest this.
Kind of what the Jill was saying. It's very individualized for everybody's body.
So rather than tell people, quit taking this medicine, quit taking that medicine, which is a medical professional, pharmacist, we would never do. We ask people what their goals are, and we give them education and information to help them achieve their goals. Because in the end, no matter what your doctor tells you have to do, it's your body, and it is always your choice.
Absolutely. It's a perfect time to bring Jill back into the conversation. Because you guys have dealt with a lot of patients. I mean, cumulatively over the past 2 years, if you had to estimate how many people you've sat in that consult room with and kind of started them on this journey of finding out what's going to work best for them medically, there's got to be some incredible stories that you've not only seen the beginning of, but seen kind of the pinnacle of. These people come into our place, they're not sure what to do. A lot of them have tried opiates. A lot of them have tried so many different other things, including other holistic things as well. Not every shoe fits every person, regardless of what it is. If I were to ask you both for, one giant success story that you've seen patient-wise from the Healing Center, Jill, what would be the first one that pops to mind for you?
Well, I do have a patient who's been suffering from seizures for years now, and she was off all of her prescription medications and she started using medical marijuana. It's been about a year and a half now, and I started it with her. Wasn't really sure what exactly what to recommend, but started her on something. And every time she comes back, she sees me for a consult, and we go over her treatment and we tweak it a little bit here and there because she was still having some breakthrough seizures.
Sure.
And so, but I think we've gotten to the point now where they're finally under control.
Wow.
And it's just, she's.
How long did
well.
that take to kind of find that balance with that patient where she had those seizures under control?
I would say probably over a year.
Over a year.
Just to finally get it to the point where she's not having them anymore.
Back to the point of it's definitely a journey. I mean.
Exactly. Right. It's not going to happen overnight. So it can take time, but she didn't give up. And and she's finally seeing the benefits that she was looking for.
And how many was she having before she started trying medical cannabis?
I would say maybe 1 or 2 a week.
Oh, wow.
Mm-hmm.
That's I can't imagine how traumatic that is on your mind and your body to go through that twice a week. That's.
I mean, they were smaller seizures. They weren't grand mal or anything
Sure. Okay.
major. But still, the fact that now they've, she's not having any is just remarkable.
Yeah. Mike, Mr. Butler.
To your point, I think you're right. It's hard to imagine just how traumatic seizures are.
Yeah.
For people that have them. Knowing that even if you get later on in life, anytime you can just drop. It's horrific, and it takes a terrible toll on people's mental capacities and on their body.
The fear of anticipation, even I don't know, that would be incredibly difficult to handle.
So probably the success story that sticks out the most for me. I'm a father. My little boy's 7 years old right now. We did have a little bit of trouble when he was born. Spent a couple weeks in the NICU up at McGee, and they're literally our angels that live there and work there. But in any case, a mother came in and she had started her 7-year-old autistic son with medical marijuana.
This is another patient that happened to be there at the time.
I'm sorry?
This is another patient that happened to be there at the hospital at the time.
No, this is someone that came into our dispensary.
Oh, okay.
One of our early success stories. So she had started her son on medical marijuana, and I came back a couple of weeks later and had been titrating him a little bit, but hadn't really seen much. I saw her a few weeks later when she came in, and I asked her how everything was going, and literally tears immediately started coming down her face, and she said that she had continued to titrate him up. We had him on a 1-to-1 formulation, part CBD, 1 part THC. And as she, got a little higher concentration in the kitchen one day, she looked at her husband and said, "Be careful he doesn't hurt himself on that chair." And the little boy looked at her, looked at the chair, pointed and said, "Chair, chair, chair."
And up to this point, he'd been nonverbal.
He was nonverbal. For 7 years, she had not heard her son say a word. And it affects me as well as a father. And the only thing I can think is, if my son was in that position, what would I not do?
Sure.
Is there anything that I wouldn't? Is there a length that I would not go to?
Sure.
So in the end, she said her son now follows her around the house like a parrot. Just everything she says,
just saying everything now,
like her own personal little African gray, and just repeating everything she says, and it is an absolute joy to her heart every time she hears something come out of his mouth. So that really stands out.
There's one that I talk about a lot when we're at the dispensary, and it's the one product that we have. It's the extra strength. There's a pain cream, and it's an unbelievable helpful product for localized pain. And I'll never forget, first gentleman who ever came in and told me about that product. I wasn't a patient yet, so I hadn't tried the product. Bigger gentleman, he was everybody's Pittsburgh uncle, right? He was a bigger guy. He worked in the factories. He'd driven truck for a couple of years. You just kind of how we were talking about earlier. He worked in a factory at the time, and he got the pain cream. And he started using it on his thigh because he walked with a real heavy limp all the time. I mean, I can't remember exactly, but I think he had some kind of degenerative hip disorder. And after about a week and a half of using it, His foreman looked at him and said, "Why aren't you limping anymore?" I've never noticed another person limping or not. You know, like when you get those are things you get used to, and they kind of fly under your radar. So it stood out as a big deal to me. You know, it just to show the gambit of things of that can be helped by this. You know, somebody coming from an autistic child, you know, somebody who had seizures, somebody who just wanted to be able to get some sleep and be able to walk without a limp. You know, there's about could you put a number on the applications that we've seen come into that dispensary?
Formally, yeah, 21.
Yeah, right for the conditions.
But
absolutely.
informally, absolutely not.
Yeah, absolutely.
There's really no way to measure the true impact other than the collective of literally hundreds of thousands of individual stories. That's really what we have as evidence in our holistic medicine niche where we operate, is hundreds of thousands, if not millions, of individual stories. That is our clinical trial. Hi, I'm Michael Butler, lead pharmacist, general manager with the Healing Center.
Hi, I'm Jill Zimbicki, pharmacist at the Healing Center. Thank you so much.
Thank you so much for listening to our Healing Hearts podcast.
And we're back with the Healing Hearts podcast, coming from the Center for Media Innovation at Point Park University, which is an amazing studio that they have here. And for our last segment, I think we should talk about kind of our cannabis coming out stories. You know, I came from radio, and I know when I called my mom one day and I said, "Mom, I got a job at a medical marijuana dispensary," the first thing she asked me was, "What does Gina think?" my pharmacist girlfriend. And I said, she didn't know this at the time. I said, "Mom, Gina's already signed up. She signed up before I did. She's going to be working there part-time." She said, "Oh." And then we got off the phone, and then we didn't catch up for about a week. She called me the following week. And at some point in that week, she watched the CNN special that I think Fareed Zakaria did.
Or Sanjay.
Was it Sanjay
Gupta?
Was it Sanjay Gupta did it on CNN? She saw that, and all of a sudden, as soon as Sanjay said it, everything was okay. And she was she was very excited for me to have a new occupation after Sanjay Gupta signed off on it. So what was your kind of your cannabis coming out story?
Well, I've actually had a mixture of responses. You know, my parents were happy that I was doing something that really interested me. My former coworkers thought I was a little crazy that I was leaving my old job to pursue something that was so, you know, uncertain and unknown. And then I had actually one response from my friend was, "Well, that's the future of medicine." So
really?
that
okay.
really
It's surprisingly positive.
Yeah, so
okay.
that really you know, made me feel good and very positive.
Nobody was giving you the
No one really was too negative, which was good. And it really, now as you can see, it really paid off, and I'm glad that I, you know, made that transition.
Yeah, it kind of worked out for you.
Yeah.
Mike, you have a cannabis coming out story.
Well, the main thing that sticks out for me is Chris Cohan called me one evening. It was about 7 o'clock. My little boy was 5 at the time, and made me the offer for lead pharmacist, general manager for their company, the Healing Center. My wife was on board, of course. She knew I was looking for it. So immediately she calls her mom and says, you know, that I got the job. And my little boy was in the background, and he's yelling into the phone, Grandma, Daddy got the weed job." And everybody was really happy about it. Now, the only person I was really concerned about was my father.
Really?
Ultra conservative family.
Okay.
I'm a farm boy from Greene County. So I told my dad the next morning, I said, you know, "Hey, I got a job." Yeah. I said, "It's for a medical marijuana dispensary group in Pittsburgh." He didn't look at me. He said, "Well, is it legal?" I said, "Yes, Dad, it's legal." Well, all right then. So
was there more?
I was in the clear.
Did you get more of an opinion beyond that?
He waited to see. He's sold now.
Oh, okay. He's on board now.
Oh yeah. He understands now.
It's hard making that transition, though. I mean, we even see it with patients sometimes.
One of the things I tell all patients, not all patients, but most, is, especially people that don't have any experience, is I give them this line: everything you ever learned in your life about marijuana was wrong.
Yeah.
If we think of all of recorded human history, every society, every group of people that's come across this plant have viewed it as medicine, used it as medicine until 1933. All of a sudden, it's heroin.
Right.
It's less than 100 years, and collectively, as a society, we have come full circle. And the vast majority of us now know we have been deceived, and this is medicine, and it should assume its rightful place with other medicines.
Absolutely. And we have a ton of patients. This always surprised me, that you would think it's one or the other with people, that they're either cannabis or they're pharmaceuticals. I'm always amazed at the people who find the balance between the two. They're able to cut back on their pharmaceuticals dramatically, or even just a little bit. You know, anything's a positive move, you would think, though, right?
Oh, yeah, absolutely. It's a tool in the toolbox. So when you're treating someone, you know, as a doctor, as a medical professional, you have a number of tools, a number of ways that you can, avenues you can pursue to try to bring up quality of life, decrease symptoms. And medical marijuana is one of those. It's a very legitimate option, as it well should be.
And what's nice about it is it treats so many different symptoms. Whereas, you know, with pharmaceuticals, you use one drug to treat one symptom, and then another to treat another. And then that drug gives them side effects. So you prescribe another drug to, you know, help with that side effect.
Yep. It's just stacking.
Snowballs.
Yeah.
It snowballs.
Yeah.
And I've seen that in retail pharmacy. You know, you come in and Mrs. Smith comes in and you meet her and she's a great lady and she's taking 5 meds. And a year later, she's up to 8 or 10. And a couple years later, she's at a dozen or maybe pushing 15. And within 5 years, you've known this person for 5 years, and now she's taking 18, 20 meds, and she's a completely different person than she was. And that's kind of the trap of standard medicine.
Yeah. And I only have one more thing for you guys. Our lightning round question. We're going to ask this every week. If you were going to be a strain, what strain would you be?
You go first, Jill.
Well, I would have to say there's actually a strain called Jilly Bean. It's not grown in Pennsylvania, but that was actually my nickname growing up. That's what my dad would call me, Jilly Bean. So I would have to say that one.
It's very serendipitous. Yeah, now that you work here. Mr. Butler?
I would think, and this is only since the introduction of anxiety as a medical condition, as an approved medical condition in PA, pre-98 Bubba Kush.
Okay.
Pre-98 Bubba Kush is a 1-to-1 form. It's 1 part THC, 1 part CBD. And I have an incredible amount of positive feedback from anxiety and PTSD patients specifically about how much this drug helps them get through every day without making them feel like they're high at all.
Yeah.
So it's very non-psychoactive, but incredibly effective at decreasing anxiety and PTSD symptoms.
And as our general manager, you make sure we get through every day, so it's fully appropriate.
Thanks.
If you would like more information on the Healing Center, our menu, our online ordering system, our locations, our stores, or our newest location coming in Cranberry soon, thehealingcenterusa.com. Thank you guys so much for coming today.
Healing Hearts is presented by the Healing Center, voted Pittsburgh's best dispensary. Healing Hearts is recorded at the Center for Media Innovation at Point Park University. More information is available at thehealingcenterusa.com.